Hi guys, so this is my patient Marco Polo. He has worked as a construction worker for 10 years. His last dental visit was 10 or more years ago due to his work schedule. He doesn't quite remember when. Chief complaint is halitosis and bleeding gums when brushing. His oral care is that he brushes at night, does not floss. Nutrition is he eats fast food 75% of the time and home cooked meals the other 25% of the time. Alcohol consumption is to 5 drinks per day. No allergies, does not smoke tobacco, and his systemic disease is liver disease and high blood pressure. His medications that he is on are on the ATC form. He only takes them when he remembers. His age is 35. Here are his forms, his health history and ATC forms. So he marked yes on bleeding gums, sensitivity to cold, has pain or discomfort on some loose posterior teeth. He also grinds his teeth, so that does not help his he has liver disease and high blood pressure, has been hospitalized in the past 5 years due to pain and edema on his legs and feet. He also marked yes on the back of the health history to chronic pain, malnutrition, fainting spells, and excessive urination. On the ATC form, his blood pressure is 140/99, so it's pretty high. His pulse is 72 beats per minute. His respiration is 20. And the medications he is on are baclofen, which helps with muscle spasms. He's also taking Constellose, which is used to treat constipation, but in his case, it is used to treat or prevent conditions of the brain caused by liver failure. He's also taking a multivitamin and a vitamin B complex and Tylenol when needed. Here are some radiographs of his oral cavity. So there's some vertical bone loss occurring on number 3, mesial and distal, and on number 14, mesial and distal. He has some bone loss, vertical bone loss occurring on number 30, mesial and distal, and then horizontal bone loss on 18, 19, 20 interproximal area. Furcation involvement is on number 3, 14, 15, 19, and 30. He has a radiopaque area on 29 distal, radiolucency areas on the furcation areas on 19 and 30, and 14 also has a radiolucency right around here on the mesial buccal root, and it almost looks like internal resorption. Here are his intraoral photos and his calc detection. So I classified him as a perio skill 4 and a calc level 3. His bleeding index or his plaque index is 44%. And he has moderate buildup sub G and supra. Perio assessment, he has quite a bit of 6s, 7s, and 8s. Some recession on those posterior teeth where furcation involvement is occurring. And I classified him as a perio case type 4 due to his bleeding upon probing. And he also has pocket depths that are greater than or equal to 6 millimeters on more than 30% of the teeth, which is considered generalized. He has biofilm, pretty heavy. Um, Tooth loss, he does have some teeth that are missing, which are his wisdom teeth, but he got those removed when he was younger, so they are not due to periodontitis. Mobility, he has class 1 on number 4, 13, 15, 19, and 29, and class 2 mobility on 3, 14, and 30. He has some furcation involvement, class 1 on number 15, class 2 on number 19, class 3 on number 3, 14, and 30. So he is actually at high risk for caries due to frequent sugary foods and drinks that are consumed in between his meals. I recommended for him to set a timer for 2 minutes using modified Bass technique when brushing. Use a tongue scraper after brushing to remove bacteria from his tongue and treat the halitosis. I also recommended for him to keep brushing nightly, but to start implementing morning brushes to at least twice a week to make gradual changes to better oral hygiene care. I also recommended a mouth rinse such as Crest Pro Health, which the one that has fluoride, and then the active ingredient would be sodium fluoride with no alcohol to reduce the risk for caries and treat his chief complaint, halitosis. I also recommended for him to use floss daily to improve gum health and also reduce the amount of bleeding. Using interproximal brushes on posterior teeth to help clean out exposed furcation areas on number 3, 14, and 30. I also recommended for him to eat soft, nutritious foods due to mobility on those posterior teeth. And I also recommended that if he does have sugary foods or drinks in between his meals, then I would recommend him rinsing with some water to decrease the amount of sugars in his oral cavity. So this is his dental hygiene care plan. So I'm going to go over the first box because the second box is pretty repetitive. The first box is his systemic disease, which is liver disease. He's at risk for liver cirrhosis due to his alcohol dependence, and he's also at risk for local anesthetic overdose. Um, he also has high blood pressure, so he's at risk for heart attack, stroke, and cardiac arrest. His medication, baclofen, causes, or he can be at risk for orthostatic hypotension and xerostomia. So we'd have to watch that on his recare visits, make sure that he's not experiencing that, and if he is, then giving him some recommendations. I also classified him as a ASA 3, which he is at risk for a heart attack, cardiac arrest, stroke, or hypotension due to the medication that he is on. He's pretty active. He works as a construction worker. His fillings are he's at risk for microleakage, recurrent decay. He has slight dental knowledge, so he's at risk for dental caries, periodontal disease, tooth loss, which we're seeing. His health behaviors are poor. He's at risk for dental caries, periodontal disease. Cultural factors are alcohol consumption after work, at risk for liver damage and malnutrition. Dental examination, on extraoral, I found generalized loss of demarcation of the vermilion border, which is puts him at risk for skin cancer, and that's due to solar damage. Intraoral examination, we found some furcation involvement and puts him at risk for tooth loss. He does have some restorations. He has one on number 19, occlusal amalgam, and that puts him at risk for microleakage, recurrent decay. He's also, he has chronic perio, so that puts him at risk for tooth loss. I also classified him as a periodontal case type 4, and he is active. On the back of the camera, I did my planned interventions. So I found furcation involvement on number 19, 33, and 14, and vertical bone loss on number 3, 14, and 30. And my education and counseling is to arrest and control disease. Oral hygiene instructions are to use of interproximal brushes to remove debris in the furcation areas. And expected outcomes are, I'm hoping that he brushes using the modified Bass technique, and I will evaluate it through plaque index next time he comes in. I'll also, another goal we have is that I would like for bleeding to decrease when he brushes, so we'll find out through probing. Halitosis, treat halitosis by using the mouth rinse, so he could verbally tell me that, or through his plaque index we can find out how much plaque accumulation there is, and just see from there how well he's doing in brushing. Another goal is flossing daily and the use of interproximal brushes, and we would find out how well he's doing through his perio assessments. So seeing if his gingiva has changed, the contour, the color, the consistency of it, and as well as his probing depths. So if they have decreased, or if they've gotten better. So my appointment plan is, I plan on his first appointment being assessments, a full mouth of x-rays, and a comp exam, which the doctor will do. And then his second appointment will be SRP on the upper left and the lower left. His third appointment will be SRP on the upper right, lower right, and I will educate the patient by having them swish with warm saline water and take over-the-counter analgesic meds if they are experiencing any discomfort after SRP. And then in 4 to 6 weeks later, I'll re-evaluate and talk to the patient about the importance of recare appointments and meticulous home care. So I am hoping that I put him on a 3-month continuing care interval, and I'm hoping that his swelling decreases, his probing depths reduce after SRP, and decrease the amount of pseudopockets as well. So my proposed treatment is to use of Arestin on all sites that are 5 millimeters of pocket depth or above. I'll make sure that the patient is not allergic to tetracycline or doxycycline, because that is the contraindication. If anesthetic is needed, a choice of prilocaine would be